could silently harm one of your vital organs. Did you know that chronic kidney disease affects approximately 15% of adults in the United States? According to the National Kidney Foundation, millions of people are at risk of kidney failure, largely due to dietary choices. Alarming, right? These numbers are a stark reminder of the importance of paying attention to what we consume every day. That's why in today's video, we'll explore 5 common foods that are silently destroying your kidneys. It's shocking that some of the foods you consume every day that you think are harmless or even healthy can have a detrimental effect on your kidney health. We're here to help you understand the risks and make better choices for your health. Let's start with the first food on today's list. 1. Peanuts. What are peanuts? Peanuts, also known as peanuts, are nuts with a hard shell, widely used in everyday cuisine, from snacks to main dishes. The most special thing about peanuts is their rich protein and mineral content. According to research, 100 grams of peanuts contain about 25.8 grams of protein and 705 milligrams of potassium. The scientific reason for this problem is that the high amount of protein and potassium in peanuts can cause a great burden on the kidneys. For people with poor kidney function, consuming too much peanuts can lead to hyperkalemia, causing the kidneys to overwork, leading to impaired kidney function. This is an important difference from other foods in this topic. For example, compared to sunflower seeds, which contain only about 21 grams of protein and 645 milligrams of potassium per 100 grams, peanuts are clearly a more dangerous candidate for kidney health. One notable piece of information is that according to the World Health Organization, WHO, consuming too much peanuts can cause hyperkalemia, which is especially dangerous for people with chronic kidney disease. Specifically, a study from WHO shows that people who consume more than 50 grams of peanuts per day have a 30% higher risk of experiencing kidney problems compared to people who consume less. Not only that, peanuts also contain phytate, a mineral absorption inhibitor that reduces the effectiveness of other nutritional absorption, which can cause other health problems such as anemia and malnutrition. Some other studies have also shown that improper consumption of peanuts, such as eating them raw or without thorough processing, can lead to the risk of aflatoxin poisoning, a toxin produced by mold on the ground peanuts, which can cause liver and kidney damage. To minimize the negative effects of peanuts on the kidneys, you can apply some of the following tips. First, limit the amount of peanuts you eat daily to less than 50 grams to reduce the load on the kidneys. Second, try combining peanuts with fiber-rich foods such as green vegetables and fruits to help balance the amount of protein and minerals absorbed into the body. For example, a meal with a green salad and some peanuts might be a better choice. If possible, replace peanuts with other seeds that are lower in protein such as sunflower seeds, 21 grams of protein, or chia seeds, 17 grams of protein, to reduce the burden on the kidneys. Chia seeds also have the advantage of being rich in omega-3s, which help reduce inflammation and improve kidney function. In particular, always make sure to drink enough water when consuming peanuts to help the kidneys filter out waste more effectively. A person should drink at least 8 glasses of water a day to maintain healthy kidney function. Make sure peanuts are processed properly. Avoid eating raw or moldy peanuts to reduce the risk of aflatoxin contamination. Roasting or cooking peanuts before eating is one way to reduce this risk. Next, have you ever wondered why foods containing phosphorus can negatively affect your kidneys? Let's find out now. 2. Foods containing phosphorus. Phosphor is an essential mineral that helps strengthen bones and maintain cell function. However, when consumed in excess, phosphorus can cause negative health effects, especially on the kidneys. Foods rich in phosphorus include meat, eggs, milk and dairy products. These foods, when consumed in excess, can lead to a mineral imbalance in the body, causing hyperphosphorylation in the blood. For people with chronic kidney disease, this is especially dangerous because their kidneys cannot remove excess phosphorus. For example, a cup of milk contains about 250 milligrams of phosphorus, equivalent to 35% of daily needs, which can quickly add up and exceed recommended levels if left unchecked. According to the World Health Organization, WHO, consuming too much phosphorus can lead to serious health problems. Specifically, it increases the risk of cardiovascular disease and osteoporosis. Excess phosphorus in the blood reduces calcium levels, leading to bone loss and weak bones. A WHO study found that more than 50% of Americans consume more than the recommended daily amount of phosphorus, which further increases the risk of kidney and cardiovascular diseases. Processed foods, carbonated soft drinks, and fast foods are the main sources of phosphorus, often containing more phosphorus than natural foods. For example, a can of soda can contain up to 50 milligrams of phosphorus. To reduce the amount of phosphorus in your diet, you can apply some of the following tips. Limit consumption of processed foods. These foods often contain a lot of phosphorus. Instead, priority should be given to fresh foods. For example, choosing fresh vegetables instead of canned or frozen vegetables can reduce your phosphorus intake. Choose products that are low in phosphorus. Low-fat yogurt products and nut milks have lower phosphorus content than regular milk. For example, almond milk only contains about 20 milligrams of phosphorus per cup compared to 250 milligrams in cow's milk. Cooking at home helps you control the amount of phosphorus in food. Limit the use of spices and additives containing phosphorus, such as baking powder or industrial sauces. For example, making your own salad dressing instead of buying pre-made will help you control the amount of phosphorus. If you have kidney disease or are concerned about the amount of phosphorus in your diet, consult your doctor for detailed advice. This way, you can protect your kidney health and maintain mineral balance in your body. Next, did you know that a common fish in our daily diet can also harm the kidneys? 3. Tuna. Tuna is a nutritious sea fish that often appears in many dishes around the world, from sushi and sashimi to salads and sandwiches. A special feature of tuna is its high protein content, providing about 30 grams of protein in every 100 grams of fish. However, not everyone knows that tuna contains a lot of mercury, a heavy metal that can cause serious damage to the kidneys and nervous system. Mercury is a toxin that accumulates in the body over time and has the potential to cause great harm if tuna is consumed regularly. A study from the World Health Organization, WHO, shows that mercury content in tuna can reach 1.0 parts per million, ppm, a level much higher than other types of fish, causing concern about food safety and health. Specific example, a can of canned tuna can contain 30 to 50 micrograms mg of mercury, which exceeds the recommended daily safe level for adults if consumed daily. In addition to the risk of mercury, tuna can also cause other health problems that few people know about. According to a report by the U.S. Environmental Protection Agency, EPA, children and pregnant women should limit their consumption of tuna to avoid negative effects on fetal and child development. Mercury not only harms the kidneys but also affects the central nervous system, causing symptoms such as fatigue, memory loss, and decreased ability to concentrate. In addition, a study by the Swedish Institute of Environmental Medicine, IMM, showed that people who consume tuna more than 3 times per week are twice as likely to develop chronic kidney disease than people who consume it less often. Data from the study also shows that the average person can absorb up to 200 micrograms of mercury per week just from eating tuna, far exceeding the safe level recommended by the WHO to minimize the effects of mercury from tuna. There are some specific measures you can take to protect your kidney health. First, limit your tuna consumption to a maximum of 1-2 times per week and replace it with lower mercury fish like salmon, sardines, and anchovies. For example, salmon contains only about 0.09 ppm of mercury, much lower than tuna. Besides, you should supplement foods rich in selenium such as sunflower seeds, chia seeds, and other seafoods such as oysters and shrimp, because selenium is a mineral that can reduce the effects of mercury in the body. A study from the U.S. National Institute of Nutrition found that supplementing with 55 micrograms of selenium per day can help reduce the effects of mercury. Additionally, making sure to drink enough water daily is also important to support kidney function and help remove toxins from the body. Water not only helps maintain fluid balance in the body but also plays an important role in eliminating toxic substances. If you can't give up tuna, choose high-quality tuna from reputable sources, check for mercury content, and avoid tuna products from polluted waters. These measures will help you reduce the risk of kidney problems caused by consuming mercury-containing tuna. So do you know what a common vegetable contains oxalate, a substance that can form kidney stones when consumed in excess? Let's explore further in the next part. 4. Vegetables contain oxalates. What vegetables contain oxalate? This is a group of vegetables high in oxalate, including spinach, amaranth, and sweet potato. Oxalate is an organic compound that can combine with calcium in the body to form kidney stones. The notable difference between these vegetables and other vegetables is their higher ability to cause kidney stones. For example, a 100 g serving of spinach can contain up to 600 milligrams of oxalates, whereas most other vegetables contain only small amounts of oxalates. Few people know that according to the World Health Organization, about 10% of the global population is affected by kidney stones, and a large part of this is due to oxalates in food. In particular, Americans consume about 1.6 million tons of spinach each year, contributing to the high rate of kidney stone cases. A Harvard University study also showed that people who consume more than 200 milligrams of oxalate per day are 1.5 times more likely to develop kidney stones than those who consume less. To reduce the risk of kidney stones from oxalate-containing vegetables, you can apply the following tips: drink enough water. Increasing daily water intake helps prevent the crystallization of oxalate and calcium in the kidneys. Try to drink at least 2.5 liters of water every day. Limit your intake of foods high in oxalates. In addition to spinach, you should limit your intake of other foods such as beets, almonds, and chocolate. Combined with calcium-rich foods, consuming calcium-rich foods such as milk and cheese along with oxalate-containing vegetables can help reduce oxalate absorption into the body. For example, eating a serving of spinach with 100 g of cheese can reduce oxalate absorption by up to 30%. Cooking vegetables can reduce the oxalate content in vegetables. Boil or steam the spinach and discard the boiling water to remove most of the oxalates. The next drink is very popular around the world, especially in America, but it has a very bad impact on your kidneys. Let's find out. 5. Carbonated drinks. Carbonated drinks, also known as soft drinks, are carbonated drinks that contain a lot of sugar and coloring agents. The most special feature of carbonated drinks is the combination of sugar and phosphoric acid. Science has proven that these ingredients can lead to the formation of kidney stones and cause kidney damage. Soft drinks contain an average of 39 g of sugar per 355 milliliters can, far exceeding the recommended daily sugar intake. In particular, regular consumption of soft drinks can reduce the filtering ability of the kidneys, leading to serious health problems such as kidney failure. According to World Health data, excessive consumption of sugar from carbonated drinks is one of the main causes of chronic kidney disease. A study by the American Heart Association found that consuming 2 or more cans of soft drinks per day can increase the risk of kidney failure by up to 30%. Furthermore, artificial colorings in carbonated drinks, such as colored caramel, may contain toxic compounds that damage kidney cells. Many people are not aware that it is not only sugar-free carbonated drinks that are harmful, but also diet soft drinks that contain artificial sweeteners that can negatively affect kidney health. To minimize the negative effects of carbonated drinks on the kidneys, consider some of the following tips. First, limit your intake of soft drinks to no more than 1 can per week, and replace them with water or fresh juice. Reading ingredient labels carefully before buying is also an important step, helping you avoid soft drinks that contain a lot of sugar and coloring agents. Furthermore, increase your drinking of filtered water every day, at least 2 liters, to help your kidneys filter out toxic substances more effectively. Another way to protect your kidneys is to use natural foods. Instead of drinking soft drinks, you can try natural drinks like unsweetened green tea or natural fruit juice. These drinks not only provide energy but also do not harm the kidneys. By applying these tips, you will not only protect your kidney health but also improve your overall health. It is important that you are aware of the effects of carbonated drinks and take timely preventive measures. Thank you so much for watching. If you found this video helpful, please give it a thumbs up, share it with your friends, and don't forget to subscribe to our channel for more valuable health tips. In summary, ignoring these dangerous foods could lead to severe kidney damage, leaving you with lifelong health issues. But don't worry, our simple, easy-to-follow advice can help you avoid these risks and maintain a healthy lifestyle. Remember, you have a choice. Follow these tips to protect your kidneys or face serious health problems that even doctors might not be able to fix. The tips shared in this video are straightforward and practical, designed to fit into your daily routine effortlessly. Implementing these changes can significantly improve your kidney health and overall well-being. Now, it's up to you. Will you take action to safeguard your health, or will you risk the dangerous consequences? The choice is yours, but remember, prevention is always better than cure. While waiting for our next video, be sure to check out these 4 videos on your screen right now. They are packed with more valuable health insights just for you. Thank you once again for watching until the end. We appreciate your support and look forward to seeing you in our next video. Take care and see you soon. Did you know that millions of people are silently suffering from kidney issues without even realizing it? Right here in the United States, an alarming number of individuals face kidney-related challenges, many of which go unnoticed until it's too late. Your kidneys, those vital organs tucked away out of sight, play a critical role in your overall health. They're your body's natural filtration system, tirelessly working 24/7 to remove waste and excess fluids from your blood. They keep everything from your blood pressure to your mineral levels in perfect balance. But here's the catch. Kidney damage is a silent process. By the time symptoms become noticeable, considerable damage might already have been done. That's why understanding and recognizing the early warning signs your body is sending could be a game changer for your health. Today, we're diving deep into the silent signs that could indicate your kidneys are in distress, underscoring the vital importance of kidney health. Stay with us to uncover what your body might be trying to tell you. Sign number 1, fatigue and weakness. When the kidneys are damaged, their ability to perform critical functions, including the production of the hormone erythropoietin, is compromised. Erythropoietin plays a pivotal role in the body's mechanism for producing red blood cells. These cells are essential for transporting oxygen from the lungs to the rest of the body, providing the energy needed for various bodily functions. As kidney function deteriorates, the production of erythropoietin decreases, leading to a significant reduction in the production of red blood cells, a condition known as anemia. Anemia associated with kidney damage manifests through symptoms of fatigue and weakness, which occur because the body's tissues and organs are not receiving an adequate supply of oxygen. This oxygen deficiency means that even normal activities can become exhausting, as the body is unable to generate the energy needed to perform tasks. Individuals may feel tired all the time, irrespective of how much they rest. This persistent fatigue significantly impacts one's quality of life, making even simple everyday activities challenging to accomplish. Understanding the link between kidney damage, decreased erythropoietin production, and anemia is crucial. It highlights the importance of early detection and management of kidney issues. To prevent the onset of fatigue and weakness and maintain overall health and well-being. Sign number 2, changes in urination. Changes in urination are key indicators of kidney health, signaling potential problems when they deviate from normal patterns. The kidneys play a vital role in filtering waste from the blood and regulating urine production. When they are damaged or not functioning properly, various symptoms related to urination can arise, including changes in frequency, the appearance of blood, pain during urination, and alterations in the amount of urine produced. Frequent urination might mean the body is trying to eliminate excess waste or fluids. A task made more difficult if the kidneys are impaired. Conversely, less frequent urination could suggest the kidneys are not filtering blood as effectively as they should, leading to less waste being processed into urine. Painful urination is often a sign of infection or inflammation in the urinary tract, which can also affect the kidneys and exacerbate existing kidney problems. The presence of blood in the urine, a condition known as hematuria, is particularly alarming as it indicates potential damage to the kidney's filtering system. This damage can allow red blood cells, which are normally kept in circulation, to leak into the urine. These symptoms, ranging from changes in urination frequency to the appearance of blood, underline the importance of monitoring urinary habits as a reflection of kidney health. Identifying and addressing these symptoms promptly can be crucial in diagnosing and managing underlying kidney issues before they progress further. Sign number 3, swelling in ankles, feet, or hands. When the kidneys are healthy, they effectively remove excess fluid and waste from the body, maintaining a balance that prevents swelling. However, when the kidneys are failing, their ability to perform this critical function diminishes. As a result, excess fluid starts to build up in the body, leading to swelling, a condition medically known as edema. This swelling is most noticeable in the ankles, feet, and hands, areas that quickly show the effects of fluid retention. Swelling caused by kidney failure is not just a superficial issue. It's a sign that the kidneys are not able to manage the body's fluid balance, which can have a cascade of health implications. The retention of fluid not only affects the appearance of the ankles, feet, and hands, but can also put additional strain on the heart and blood vessels, contributing to hypertension, high blood pressure, and further complicating kidney health. This symptom underscores the importance of kidney function in overall health and well-being. Swelling in the ankles, feet, or hands should not be ignored, as it is a tangible sign that the kidneys may be under distress. Early recognition and treatment of kidney issues can help manage symptoms like swelling and prevent potential complications, highlighting the crucial role of kidneys in managing fluid balance and maintaining health. Sign number 4, puffy eyes. Puffy eyes can be an unexpected indicator of kidney issues, particularly when linked to the presence of protein in the urine, a condition known as proteinuria. Under normal circumstances, the kidneys filter waste from the blood while retaining essential components, including proteins. When the kidneys are damaged, their filtering abilities are compromised, allowing proteins that should be retained in the bloodstream to leak into the urine. This loss of protein can lead to a series of reactions in the body, one of which is fluid retention. The area around the eyes is especially prone to swelling because the skin is thinner and more sensitive to changes in fluid balance. Thus, when the body starts retaining fluid due to the loss of protein through the kidneys, it can manifest as puffiness around the eyes. Puffy eyes related to kidney damage are more than just a cosmetic concern. They signal a deeper problem with kidney function and the body's ability to maintain its delicate balance of proteins and fluids. Recognizing this symptom as a potential sign of kidney issues is crucial for early intervention and treatment. Addressing the underlying kidney damage can help alleviate proteinuria and its symptoms, including puffiness around the eyes, while also safeguarding overall health by restoring the kidney's filtering capabilities. Sign number 5. Dry and itchy skin. Dry and itchy skin can often be more than just a superficial irritation. It may indicate a deeper health issue, such as kidney failure. When the kidneys fail to function properly, they can't maintain the balance of minerals and nutrients in the blood. This imbalance can lead to a condition known as mineral and bone disease, which affects the health and integrity of the bones and skin. The kidneys play a critical role in processing and balancing minerals, such as calcium and phosphorus, in the body. They also help manage the levels of other important substances, including vitamin D, which is essential for bone health and maintaining the skin's moisture. Kidney failure disrupts this delicate balance, leading to changes in the skin's condition. The resulting mineral imbalances and the buildup of wastes in the blood can cause the skin to become dry, itchy, and irritated. This itchiness isn't relieved by regular moisturizers or creams because the problem isn't just on the skin surface. It's a manifestation of the internal issues caused by kidney failure. The dryness and itchiness are symptoms of the body's struggle to manage its mineral content and eliminate waste effectively. Addressing dry and itchy skin caused by kidney issues involves more than just topical treatments. It requires medical intervention to manage the underlying kidney condition and restore the balance of minerals in the body. Effective treatment of kidney failure can alleviate the symptoms, including the uncomfortable skin conditions, underscoring the importance of kidney health for overall well-being. Sign number 6, metallic taste in mouth. When the kidneys are healthy, they filter out waste materials from the blood. But if they're not working well, these wastes can build up, leading to a condition known as uremia. One of the lesser-known but distressing symptoms of uremia is a metallic taste in the mouth. This unpleasant taste sensation is not just a random occurrence. It's directly related to the accumulation of toxins and waste products in the bloodstream that the kidneys fail to eliminate. This buildup of wastes can affect various bodily functions, including taste and smell. When the concentration of these waste products becomes high, it can alter the way food tastes, leading to that persistent metallic flavor. This change in taste can also be accompanied by bad breath, another side effect of the waste accumulation, further impacting a person's well-being and quality of life. The metallic taste in the mouth is more than just an annoyance. It's a signal from the body that the kidneys are struggling to perform their vital role of cleansing the blood. It's essential to recognize this symptom as a possible indicator of kidney issues, prompting medical consultation and testing. Addressing the underlying kidney dysfunction can help alleviate this and other symptoms related to uremia, improving the individual's overall health and well-being. Sign number 7, nausea and vomiting. Nausea and vomiting are common symptoms that can stem from a wide range of conditions, but when they are persistent without a clear cause, they might indicate a problem with kidney function. Specifically, these symptoms can arise from the buildup of waste products in the body, a condition that occurs when the kidneys are unable to adequately filter and eliminate toxins from the bloodstream. The kidney's primary function is to remove waste materials and excess fluids from the blood, which are then excreted through urine. When the kidneys are damaged or fail to work correctly, these waste products accumulate in the bloodstream, leading to a condition known as uremia. Uremia can have a wide-ranging impact on the body, including the gastrointestinal system. The accumulated toxins can irritate the stomach lining, leading to feelings of nausea or the urge to vomit. This discomfort is not just limited to the digestive tract. It's a systemic response to the increased levels of toxins that the kidneys are not filtering out. The presence of these toxins can trigger the brain's vomiting center, a complex mechanism involving multiple areas of the brain that coordinate the vomiting response. Addressing nausea and vomiting in the context of kidney disease involves treating the underlying kidney dysfunction to reduce the levels of toxins in the blood. This may require medical interventions such as medication, dialysis, or, in advanced cases, kidney transplantation to restore the body's ability to eliminate waste products effectively and relieve the symptoms of uremia. Sign number 8, shortness of breath. Shortness of breath, a distressing symptom affecting one's ability to breathe easily, can be a significant indicator of kidney damage. For this symptom may arise from two main issues related to kidney dysfunction: fluid buildup in the lungs and anemia, both of which are closely tied to the kidney's ability to maintain the body's fluid balance and produce red blood cells. Firstly, when the kidneys are damaged, their capacity to remove excess fluid from the body diminishes. Instead of being excreted, this fluid can accumulate in different parts of the body, including the lungs, a condition known as pulmonary edema. This accumulation in the lungs makes it harder for them to expand during breathing, leading to a feeling of breathlessness or shortness of breath. This symptom can be particularly noticeable during activities or even at rest in severe cases. Secondly, kidney damage affects the production of erythropoietin, a hormone crucial for the formation of red blood cells. A decrease in red blood cell production leads to anemia, a condition characterized by a reduced capacity of the blood to carry oxygen. With less oxygen available to meet the body's needs, muscles and organs, including the lungs, have to work harder to oxygenate the body, leading to fatigue and shortness of breath. Both these conditions, fluid buildup in the lungs and anemia, highlight the critical role kidneys play in regulating the body's fluid and blood cell levels. Addressing the underlying kidney issues is crucial to managing and alleviating shortness of breath, underscoring the importance of early detection and treatment of kidney damage. Sign number 9, feeling cold. Feeling persistently cold, even in warm environments, can be a puzzling and uncomfortable symptom. This sensation is often linked to anemia, a condition that can arise as a consequence of kidney disease. Anemia occurs when there is a shortage of red blood cells, which are responsible for carrying oxygen from the lungs to the rest of the body. When the kidneys are damaged, they produce less erythropoietin, a hormone that prompts the bone marrow to make red blood cells. As a result, the body ends up with fewer red blood cells, diminishing its ability to transport oxygen efficiently. Oxygen is essential for the production of energy in the body's cells, including those that regulate temperature. With less oxygen available, the body struggles to generate sufficient heat, leading to feelings of coldness. This symptom can be particularly noticeable in the extremities, such as the hands and feet, but can also affect the individual's overall sense of warmth. The link between kidney disease and feeling cold is a critical reminder of the kidney's role beyond filtering waste. They are also crucial in maintaining the body's delicate balance of red blood cells. Addressing the root cause of anemia through treatments aimed at improving kidney function can help alleviate this persistent coldness, improving the individual's comfort and quality of life. Sign number 10, dizziness and trouble concentrating. Dizziness and trouble concentrating are symptoms that can significantly impact daily life, often making even simple tasks feel challenging. These symptoms can sometimes be linked to anemia, a condition characterized by a lower than normal count of red blood cells, which is common in individuals with kidney disease. Anemia results from the kidney's reduced ability to produce erythropoietin, a hormone that signals the bone marrow to produce red blood cells. These cells are responsible for carrying oxygen throughout the body, including to the brain. When the brain doesn't receive enough oxygen because of a reduced number of red blood cells, it can lead to symptoms like dizziness and difficulties with concentration. Oxygen is essential for brain function, fueling brain cells and helping them work efficiently. Without adequate oxygen, cognitive functions such as memory, attention, and the ability to process information can be impaired, manifesting as trouble concentrating and feeling lightheaded or dizzy. These symptoms can be especially troubling because they affect an individual's ability to perform everyday activities, impacting their quality of life. Recognizing and treating anemia in the context of kidney disease is crucial. Treatments may include medications to increase red blood cell production, supplements to address deficiencies such as iron, vitamin B12, or folic acid, and in some cases, dialysis or kidney transplantation to improve kidney function. Proper management of anemia can help alleviate these symptoms, improving oxygen flow to the brain and enhancing overall cognitive function. Sign number 11, pain in the lower back. Pain in the lower back, particularly in the area where the kidneys are located, can be a sign of underlying kidney problems. This discomfort may range from a dull ache to sharp, severe pain and can indicate conditions such as polycystic kidney disease, PKD, or kidney stones. Polycystic kidney disease is a genetic disorder characterized by the growth of numerous cysts filled with fluid in the kidneys. These cysts can enlarge the kidneys and disrupt their function, leading to pain in the back or sides. The pain is often caused by the pressure from the growing cysts, the stretching of the kidney or surrounding tissues, and sometimes by cyst infections or bleeding. Kidney stones, on the other hand, are hard deposits of minerals and salts that form inside the kidneys. When these stones move through the urinary tract, they can cause excruciating pain, often described as one of the most severe types of pain imaginable. This pain, known as renal colic, can be felt in the back, lower abdomen, or groin. Both conditions affect kidney function and can lead to further complications if not treated. It's important for individuals experiencing persistent or severe lower back pain, especially when accompanied by other symptoms like changes in urination, blood in the urine, or fever, to seek medical evaluation. Early diagnosis and treatment of kidney-related back pain can prevent complications and preserve kidney health. Sign number 12, high blood pressure. High blood pressure, also known as hypertension, is a common health condition where the force of the blood against your artery walls is consistently too high. The kidneys play a critical role in regulating blood pressure through a balance of salt and fluid in the body. They filter your blood, removing excess salts and water, which can affect blood pressure levels. The kidneys use a complex system of hormones and enzymes to communicate with other organs and manage blood pressure effectively. When the kidneys are damaged, their ability to regulate these processes is impaired. This can lead to an accumulation of salt and fluid in the body, causing blood pressure to rise. Additionally, kidney damage can lead to a reduced production of substances that help dilate blood vessels, further contributing to increased blood pressure. High blood pressure, in turn, can create a vicious cycle by causing further harm to the kidneys. Elevated pressure in the blood vessels can damage the tiny blood vessels in the kidneys, reducing their filtering ability. This damage can exacerbate kidney disease, leading to a worsening of both kidney function and blood pressure control. Managing high blood pressure is crucial for maintaining kidney health and preventing further damage. This can involve lifestyle changes such as diet and exercise, as well as medication to control blood pressure. Regular monitoring and treatment of high blood pressure are essential steps in preventing kidney damage and maintaining overall cardiovascular health. Next, I will talk about preventative measures for silent signs of kidney disease. Preventative measures for maintaining kidney health and preventing issues like high blood pressure involve a combination of lifestyle changes and regular health checkups. Adopting a balanced diet low in salt and processed foods and rich in fruits, vegetables, and whole grains can significantly impact kidney health. Regular physical activity helps maintain a healthy weight and manage blood pressure. Staying hydrated, limiting alcohol consumption, and avoiding smoking are also crucial. Regular monitoring of blood pressure and blood sugar levels can catch potential problems early. Finally, annual checkups with your healthcare provider allow for early detection and management of any kidney-related issues, safeguarding your overall health. Before we wrap up, if you found this information helpful, please take a moment to like and share this video. Spreading awareness about kidney health is crucial, and your share could help someone recognize the signs early and seek the help they need. If you've experienced any of these symptoms or have tips on maintaining kidney health, we'd love to hear from you in the comments below. Your insights could provide great support and information to others. Don't forget to subscribe to our channel for more health-related content. By staying informed, we can all take better care of our health and prevent issues before they arise. Thank you for watching, and let's continue to support each other in leading healthier lives. Avoid these 7 plant-based foods that can damage your kidneys. In recent years, many experts have suggested the benefits of a plant-based diet in reducing the strain on your kidneys. But just because something is from a plant doesn't mean it's good for your kidneys, particularly if you have kidney disease. In reality, some plant-based foods can actually pose risks, and cutting back on them would bring lasting rewards. Watch this video to learn 7 plant-based foods you should avoid to protect your kidneys. Before we dive in, please note all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 7. Seed oils. Seed oils are plant-based cooking oils obtained from seeds. Examples are rice bran, canola, corn, cottonseed, grapeseed, soybean, sunflower, safflower, and peanut oils. These oils are promoted as valuable lipid sources due to their healthy fatty acid content and bioactive compounds. However, these oils have undergone extensive processing, including bleaching, refining, and heating, to extract and clean them before they can be used for cooking and baking. Refining can strip away essential nutrients like antioxidants and sometimes produce unwanted compounds. One example is trans fatty acids, one of the most harmful compounds for your kidneys and overall health. More concerning, seed oils can contribute to inflammation in the body due to their high omega-6 fatty acid content. Inflammation is the root cause behind a long list of health conditions like kidney disease, arthritis, heart disease, and diabetes. Small amounts of omega-6 fatty acids are necessary for your overall health. However, excessive consumption, typical in Western diets, can disrupt the balance between omega-6 and omega-3 fatty acids, leading to health problems such as kidney damage. Fats are divided into saturated and unsaturated types. Unsaturated fats found in oils like olive oil are healthier, offering benefits such as improved cholesterol and heart health. Saturated fats found in animal products and some plants like coconut should be limited. Replacing saturated fats with unsaturated ones can minimize the harm caused by seed oils. Opt for unrefined oils, such as extra virgin olive oil, which retain more natural nutrients, flavor, and aroma. Because they are extracted using methods like cold pressing without high heat or chemicals, unrefined oils are tastier, healthier, more natural, and free from harmful additives. This purity and nutrient retention support overall health, including kidney function. 6. Canned vegetables and canned soups. Canned soups and vegetables are commonly consumed because of their low cost and convenience. However, these foods typically contain high levels of sodium for preservation, which can be problematic for those with kidney disease. When the kidneys are not functioning properly, they cannot effectively filter out excess sodium from the blood. This leads to a buildup of sodium, which can increase blood pressure and put additional strain on the kidneys. It is worth emphasizing that canned foods often contain added sugars or chemical additives. This is why individuals with kidney disease should avoid or limit canned foods, including canned vegetables. Instead, look for fresh or low-sodium alternatives. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 5. Chips and pretzels. Baked chips, despite their reputation as a healthier alternative to the fried version, can still pose risks to kidney health. Baked chips are highly processed and low in fat, making it easy to overeat without feeling full. Pretzels are processed baked bread snacks, which can raise blood sugar levels and promote fat storage. These effects can contribute to kidney damage over time. Potato chips and pretzels are also low in essential nutrients like fiber and protein, and can contribute to weight gain and obesity, potentially damaging your kidneys over time. Worse still, both chips and pretzels can contribute to high sodium intake, which can strain the kidneys by causing fluid retention and elevated blood pressure. High salt intake may worsen already existing kidney damage and increase the risk of cardiovascular complications like heart attacks and strokes. Try to moderate your intake of these foods in favor of healthier snack options to support kidney health. 4. Ketchup. Ketchup is made from tomatoes, which are high in potassium, and excessive potassium intake can be problematic for those with poor kidney function. Also, ketchup is often high in added sugar and sodium, which can contribute to high blood pressure and strain on the kidneys. 1 tablespoon, which is 17 grams, can contain 180 milligrams of sodium and 4 grams, which is equivalent to 1 teaspoon of sugar. It's best to choose options that are low in these ingredients, especially those that don't include high fructose corn syrup. The sugar in ketchup, like high fructose corn syrup, can lead to obesity and insulin resistance, making kidney function worse. Ketchup also has lots of phosphorus, which isn't good for individuals with kidney issues. Too much phosphorus can cause problems since damaged kidneys struggle to filter it out. It's important to avoid other store-bought condiments that might cause similar adverse effects. This includes salad dressing, barbecue sauce, and soy sauce, as they often contain high levels of sodium, sugars, or chemical additives. Rather than topping your favorite summer dishes with these condiments, consider using salsa. Choose fresh, salt-free salsa from the store, or make your own at home. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 3. Instant noodles. Instant noodles are pre-cooked, dried noodles that are popular worldwide due to their convenience, long shelf life, variety of flavors, and reasonable cost. However, they are often criticized for being unhealthy due to their high sodium, carbohydrate, and trans fat content, and lack of essential nutrients like fiber, vitamins, and minerals. In 2017, Nutrition Research and Practice published a study involving 397 college students in Seoul, aged 18 to 29. The study aimed to understand how eating instant noodles affects heart and metabolic health. They found frequent instant noodle intake was linked to elevated levels of blood triglycerides and sugars and increased blood pressure. These effects can potentially cause diseases that lead to kidney damage. Instant noodles are a perfect example of ultra-processed foods, or UPFs for short, which can damage kidney function. UPFs are typically high in calories, refined carbohydrates, sugar, salt, chemical additives, and trans fats, and low in dietary fiber and essential nutrients. A 2022 study published in the American Journal of Kidney Diseases analyzed data from the Atherosclerosis Risk in Communities study, a major research initiative conducted in the United States. This study involved 679 middle-aged adults without kidney disease at baseline. After analyzing, the researchers found that each additional serving of ultra-processed foods, including canned soup, was linked to a 5% higher risk of chronic kidney disease, or CKD for short. These findings highlight the potential harm of canned soup and other ultra-processed foods on kidney health. A study conducted in Korea found that people consuming the most UPFs had a higher prevalence of CKD. The results demonstrated that every 6% increase in UPF consumption was linked with a 6% higher prevalence of CKD. This association may be due to the harmful ingredients found in UPFs, such as hydrogenated oils and chemical additives, which can cause oxidative stress and inflammation. Frequent consumption of instant noodles can harm the kidneys due to their high phosphorus content, which can raise serum phosphorus levels. Elevated serum phosphorus is linked to increased mortality and cardiovascular events. Efforts are being made to address these concerns and develop healthier versions. In Malaysia, for example, researchers have explored the use of composite flours, incorporating locally available ingredients like seaweed powder to improve the nutritional value and quality of instant noodles, while reducing dependence on imported wheat flour. 2. Frozen meals. Pre-packaged vegan-vegetarian frozen meals frequently contain lots of salt, potassium, and phosphorus, which can be bad for patients with kidney disease. Excess salt and other preservatives are often added to make these meals taste better and last longer. Moreover, excessive potassium intake can be problematic for individuals with compromised kidney function, as mentioned earlier, because the kidneys struggle to properly regulate potassium levels in the blood. However, plant-based diets in kidney disease have been shown to be beneficial, as the potassium in fresh whole plants are paired with fiber, which prevents its absorption. Talk with your dietitian about the right plant-based diet for you. Similarly, additives containing phosphorus in processed frozen foods can contribute to elevated phosphorus levels in the blood, potentially leading to bone and heart complications in those with kidney disease. Therefore, frozen meals are generally not a good choice for people concerned about kidney health, especially if consumed regularly. To make frozen meals less harmful to kidney health, choose those with lower sodium and reduced potassium and phosphorus content. This involves carefully reading labels and selecting products with minimal processed ingredients. A better option is to prepare homemade meals using fresh whole food ingredients, allowing for greater control over nutrient intake. Try cooking large batches of kidney-friendly vegetarian or vegan dishes and freezing individual portions for later consumption. By prioritizing fresh, whole foods and mindful meal planning, you can enjoy a kidney-friendly diet while minimizing potential harm. 1. Chocolate bars or energy bars. While cocoa contains phenolic antioxidants and flavonoids that can help support the function of your blood vessels, chocolate bars should be consumed with caution. Chocolate bars have high levels of saturated fats and added sugar. These components contribute to high blood sugar, high blood pressure, and weight gain, which are common triggers for kidney disease. Chocolate bars and energy bars are also considered UPFs, which are linked with an increased risk of CKD and worsen complications in patients with CKD. As mentioned earlier, UPFs are typically high in energy, low in nutritional value, and contain additives that may be harmful to kidney health. Energy bars, often consumed for replenishing electrolytes lost during exercise, can pose significant dangers to kidney health. Similar to energy drinks, they often contain high amounts of sugar to provide a quick energy boost. Also, the combination of high sugar and other additives in energy bars leads to conditions that can cumulatively strain the kidneys. Thus, long-term consumption of energy bars can accelerate kidney damage. Therefore, it is essential to minimize your consumption of these processed bars and consider fresh fruits and other healthier alternatives. Are your kidneys damaged? Healthy kidneys filter about half a cup of blood each minute, getting rid of waste and excess water to produce urine. The urine travels from the kidneys to the bladder through two thin muscular tubes called ureters. One on each side of the bladder. The bladder serves as a reservoir, temporarily storing the urine. Together, the kidneys, ureters, and bladder make up the urinary system. When your kidneys are damaged, waste and fluid build up. Over time, this can lead to kidney disease and kidney failure, which can be either acute or chronic. Acute kidney failure is usually short-term and reversible, while chronic kidney failure is a long-term condition that is progressive. Symptoms of kidney damage can include nausea, vomiting, fatigue, sleep problems, changes in urination, decreased mental sharpness, muscle cramps, swelling of feet and ankles, itchy skin, and high blood pressure. These signs might not manifest until irreversible damage has occurred due to the kidney's ability to compensate for lost function. Kidney problems can cause anemia and bone and mineral disorders, such as hyperkalemia, which can be deadly. Additionally, kidney failure can heighten the risk of heart disease or stroke. Without treatment, kidney failure is fatal. Doctors rely on biomarkers like creatinine levels, glomerular filtration rate, or GFR, and protein in the urine to assess kidney function. Newer biomarkers such as kidney injury molecule and neutrophil gelatinous-associated lipocolin show promise for early detection of kidney damage. Triggers for kidney disease include high blood pressure, high blood sugar, and high blood cholesterol levels. The increased force from high blood pressure injures the filtering units of the kidneys. Elevated blood sugar from diabetes can cause damage to small blood vessels in the kidneys, which harms the filters. Additionally, cholesterol forms plaques along the artery walls, blocking blood flow to the kidneys, which impairs their function and also causes protein loss in the urine. Other diseases and environmental factors can also contribute to kidney damage. Obesity increases the risk of chronic kidney disease, or CKD, by lowering urine pH, causing chronic inflammation, and disrupting fat metabolism. It also worsens high blood pressure, insulin resistance, and glucose intolerance, further raising the CKD risk. While CKD can be caused by various factors, including diabetes and high blood pressure, dietary choices play a significant role. This video has highlighted some plant-based foods to avoid, emphasizing the importance of opting for less processed alternatives. The one thing all of these foods have in common is that they are processed. From seed oils to flavored instant oatmeal, many processed foods contain additives that can worsen kidney disease. To maintain healthy kidneys, swap out high-sodium condiments like ketchup for homemade sauces with fresh herbs. Opt for antioxidant-rich fruits and vegetables. Choose lean proteins with less saturated fat, and stay hydrated with water. By prioritizing whole, nutrient-rich foods and limiting processed options, you can support your kidneys and prevent pre-existing kidney conditions from getting worse. Remember, consulting with a healthcare professional is necessary. Especially if you have an existing kidney condition, your doctor and registered dietitian can provide personalized guidance to help you make informed dietary choices and maintain optimal kidney health. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Have you seen any signs from our video or worried about kidney disease? Your kidneys might need a natural boost. Check out the video on the screen for the top 5 fruits that can help cleanse your kidneys. We also offer tips to get the most from them. See you there. Stay informed. Stay healthy. Eat these 5 powerful foods to boost kidney cleanse. Before we discuss how to help with kidney cleansing, let's make sure we're on the same page about what cleanse means, as this has been quite a controversial topic among the healthcare community. Some folks argue that our kidneys are designed to cleanse our bodies of toxins, so we don't need to do anything extra. Sounds reasonable, doesn't it? But think about it. Do your home water purifiers always stay clean after filtering water? Do they never get dirty? Of course not. When you eat a lot of processed foods and red meat, smoke, drink too much alcohol, or take too many medications, your body can become overloaded with toxic molecules, such as heavy metals or free radicals. These toxins can damage your kidneys or cause painful kidney stones when they build up. Sometimes, just like we clean our water purifiers, we need to give our kidneys a little extra support to remove any leftover waste that hasn't been flushed out through urine. In simpler terms, we can cleanse, and we do need to cleanse our kidneys of extra toxins. Some presume cleansing means instantly removing all toxins. While it's a nice idea, our bodies don't quite operate that way. Most detox diets haven't been scientifically proven yet and might be falsely advertised. In fact, following a detox diet to remove toxins can be risky. For example, in 2018, after trying a 5-day kidney cleanse, a healthy 67-year-old man experienced dangerously low sodium levels in his blood. This condition, called hyponatremia, can cause life-threatening problems, including brain swelling. So, the bad news is that cleansing your kidneys in 3 to 5 days is very unlikely. But the good news is, you can make nutritional changes in your diet a bit and gradually boost functioning and support cleansing of your kidneys gradually, day to day. You know, it takes years for your kidneys to be filled with toxins or injuries. So, a good cleansing journey takes time. But trust us, it's totally worth it. Imagine waving goodbye to tiredness and headaches. Feeling full of energy again. Getting quality sleep and not making endless bathroom trips anymore. Yes, you can get all these. And the secret might just be sitting in your kitchen right this minute. Now, forget about fancy routines or supplements. Let's keep it simple and natural, making the most of what you've got at home. The best thing we can do for your kidneys is eat more antioxidant-rich foods. Why? Antioxidants play a big role in cleansing your kidneys from toxic molecules called free radicals, the culprit behind many kidney diseases, not to mention protein and DNA damage. When there's an imbalance between harmful free radicals and antioxidants, it results in oxidative stress and inflammation, which are major causes of kidney disease. So, boosting your antioxidant intake is crucial for supporting kidney cleanse. Luckily, antioxidants are readily available in many natural foods, and we're here to help you discover the top sources. These foods can also lighten the load on your kidneys, keeping them clean from the beginning. These nutrient-dense foods are packed with all sorts of goodness to support kidney cleanse and detox. And the best part? They're delicious and easy to add to your meals. Stay tuned for these incredible insights to keep your kidneys cleansed, healthy, and robust. Before we dive in, kindly note that all information you'll find in this video is fact-checked, unbiased, and reviewed by qualified professionals. Alright, it's time to swing back to the first natural food to support kidney cleansing. 5. Tofu and tempeh for chronic kidney disease, or CKD patients. Experts often recommend eating more soy products, such as tofu and tempeh. These foods are low in phosphorus, potassium, and sodium, making them supportive for people with kidney diseases. Plus, they're packed with other important nutrients like omega-3 fatty acids, fiber, and protein. For example, CKD patients need high-quality protein, and soy foods can provide that. Unlike some plant proteins, soy protein is considered a complete protein containing all 9 essential amino acids which your body needs but can't make on its own. A study in Nature looked at 9 clinical trials involving 197 people with CKD. When these people consumed soy protein, their blood levels of creatinine and phosphorus dropped greatly. This decrease eases the workload on their kidneys, which have to filter these substances. In this study, soy protein also helped reduce triglycerides, a type of fat. This is good for kidneys because high levels of triglycerides have been linked with kidney function decline. Moreover, your kidneys process plant and animal proteins differently. For instance, according to nutrition facts, after eating tuna, your kidneys work 36% harder within 3 hours. But when you eat tofu, which has the same amount of protein, your kidneys often don't have to work any harder than usual. In other words, eating more tofu and tempeh instead of animal proteins may take more stress off the kidneys. In addition to protein, tofu and tempeh contain many antioxidants, B vitamins, and fiber. These nutrients help fight body inflammation, a major cause of chronic diseases, including kidney diseases. So, eating them more is like giving your kidneys extra protection. Tempeh, as a fermented food, could be a better choice than tofu. Fermentation involves culturing with beneficial bacteria or probiotics, which gives tempeh more protein and less sugar. Moreover, eating more good bacteria from tempeh may support your kidneys, as adults with kidney disease tend to have more pathogenic to beneficial bacteria in the gut, known as dysbiosis. Just a reminder, while fermented soy products are nutrient-dense, miso, unlike tempeh, can be high in sodium. For people with kidney disease, their kidneys can't filter the excess sodium, so it's important to keep their sodium intake under 200-300 milligrams. To give you an idea, a single tablespoon of miso can contain as much as 634 milligrams of sodium. If you're enjoying our videos so far, please give us some hints by dropping a like, and then we'll make more content like this. 4. Seaweed. Seaweed is a type of algae that grows in the sea. Recently, seaweed has gained attention for its kidney healing properties with fewer side effects than conventional drugs. Specifically, researchers are looking at the compound fucoidan from brown seaweed as a potential treatment for CKD. This antioxidant has shown real potential in addressing kidney issues like chronic kidney failure and diabetic nephropathy. Plus, fucoidan seems great at tackling inflammation, oxidative stress, and kidney fibrosis. It's like treating your kidneys to a relaxing spa session. Also, seaweed contains many other antioxidants like vitamins, tannin, and phenols. But before enjoying seaweed, let's pick the type you prefer. Common options include dulse, hiziki, kelp, kombu, nori, and wakame. There isn't a set daily amount of seaweed recommended. In clinical trials, beneficial doses have ranged from 130 to 500 milligrams per day. Choose seaweed from trusted suppliers with strict quality controls to lower the risk of heavy metal exposure. Look for those certified by reputable organizations for heavy metal content or at least come from less industrialized areas. But wait! Is seaweed safe for kidney disease? Note that seaweed is quite high in potassium and sodium. Removing the excess amount of these minerals can be a challenge if your kidneys aren't working well. But if your kidneys are healthy, they'll handle any extra potassium and sodium just fine, so you can enjoy seaweed without worry. Let me repeat that. Seaweed is a fantastic choice if your kidneys are in top shape. Seaweed is low in calories but rich in minerals, making it beneficial for any detox diet. Its high fiber and water content can support digestion, aiding in blood sugar control and weight loss. This can indirectly benefit your kidneys, because diabetes and obesity are common causes of kidney diseases. Moreover, eating more fiber can help reduce your risk of kidney stones and kidney diseases, and seaweed is a great source of many fiber types. On top of that, alginate, a powerful fiber in seaweed, can bind with heavy metals and toxins, helping your kidneys remove them from your body. Reports suggest that in 5 cases, using a combination of pectin and alginates reduced heavy metal levels by around 74% without any side effects. Seaweed also contains phytochemicals, further having protective benefits in the body. Plus, even though seaweed has low protein content, it's high-quality protein, containing all 9 essential amino acids, just like tempeh. Plus, seaweed is low in fat, but has some healthy polyunsaturated fats, like omega-3 fatty acids. This healthy fat can help reduce bad fats and support heart health, which is essential for proper kidney function. Just keep in mind that seaweed alone can't give you all the omega-3 you need. Let's check out the next section to find another awesome source. For those interested in the evidence, the studies supporting our claims are provided in the description box. 3. Fatty fish. When your kidneys are unhealthy or you struggle with an accumulation of toxins, it's crucial to make protein count or get the best quality that you can. Animal proteins, like those found in salmon, tuna, mackerel, and other fatty fish, are top-rated for quality because they contain complete proteins. Unlike some meats high in unhealthy fats, fatty fish give you the super healthy kind. Remember omega-3 fatty acids? We talked about them a minute ago. Omega-3s are indeed a special treat for your kidneys. They have unique properties, like anti-inflammatory and antioxidants, to keep your kidneys in top shape. A 2023 study in the British Medical Journal even found that eating more omega-3 fatty acids from seafood, but not plants, is linked to a lower risk of CKD and a slower decline in kidney function. Specifically, those with the highest levels of seafood omega-3s had a 13% lower risk compared to those with the lowest levels. In another study, people with CKD who took omega-3 supplements, meaning they consumed a significant amount of omega-3, had a reduced risk of end-stage renal disease, or ESRD in short. ESRD is a very concerning scenario when you have CKD. So yes, like we talked about before, omega-3 from plant sources are great, especially for your heart and blood pressure, as well as their anti-inflammatory effects. This will indirectly support your kidneys' function. However, to reap the most kidney benefits, don't forget to eat some fish. Many organizations recommend that healthy adults should consume 250-500 milligrams of EPA and DHA combined daily. You can get this easily by enjoying about 8 ounces of fatty fish each week. For example, a typical 3-ounce serving of salmon provides 1.83 g of omega-3, while the same serving size of sardines gives you 1. Other tasty fish options are also high in omega-3 fatty acids such as anchovies, herring, trout, mackerel, black cod, bluefin tuna, whitefish, striped bass, and cobia. Eating more omega-3 can be better for your kidneys. But it's important to note that the Food and Drug Administration recommends not exceeding 5 grams per day. Moreover, fatty fish are top natural sources of vitamin D. Vitamin D isn't just about strong bones, it does so much more. It helps maintain your blood sugar levels, protects your heart, and reduces inflammation. By doing all this, vitamin D takes some pressure off your kidneys, helping keep them healthy. Any other recommendations for omega-3 and vitamin D? Drop your thoughts in the comments. It might help someone else in our community. 2. Apple cider vinegar. Recently, apple cider vinegar, or ACV in short, has been getting much attention for its potential to help kidney stones and lower proteinuria levels. If you have other kidney conditions, ACV is also a great option because it has very little to no sodium, potassium, or phosphorus. This strong smell and tangy vinegar is basically apple juice turned into acetic acid through fermentation. Again, fermentation means some probiotics support digestion, especially in preventing constipation. Good bowel movements are crucial for flushing toxins out of the body, which helps lighten the load on your kidneys. Also, sipping on ACV regularly can help rid your body of extra toxins and harmful bacteria, reducing the workload on your kidneys. Simply put, acetic acid from ACV can kill harmful bacteria. This is also because ACV has to be diluted with a lot of water before drinking. Additionally, ACV contains antioxidants and fiber, such as pectin, which can help prevent oxidative stress inside your kidneys. A 2020 study in rats suggests that a CV may have therapeutic potential in protecting against kidney damage and dysfunction. Drinking a CV may also help with weight gain, high levels of bad cholesterol, high blood sugar, indigestion, and inflammation. As we mentioned before, these factors are the big causes of kidney problems in the first place. By helping with them, a CV creates optimum conditions for your kidney health. So with these protective benefits, can ACV help cleanse your kidneys of stones, as some online trends suggest? Actually, solid scientific studies examining the direct effect of ACV on kidney stones are lacking. A 2017 study, however, found that fermented vinegar might help prevent kidney stones. However, more research is needed to understand ACV's direct impact and potential on this disease. To harness the kidney benefits of ACV, consider these simple yet effective tips. First, ACV is generally safe in small doses to protect your tooth enamel and throat. Dilute ACV by adding a tablespoon to a mug of warm water. A common dose is mixing 1 to 2 tablespoons of ACV in a big glass of water. Begin with a small amount, such as a teaspoon a day, and then slowly increase the amount as you get used to it. For a tastier drink, add some raw honey or maple syrup or sprinkle in some cinnamon. Not only does this enhance the flavor, but it also boosts the antioxidants in your cup of ACV. But be careful. Drinking ACV straight may damage your teeth and irritate the stomach lining due to its acidity. The great thing is that ACV is very low in calories and can quickly add flavor to your meals. Using it to enhance flavors can help with weight loss and diabetes management. A typical salad dressing recipe with vinegar uses about 1 to 2 teaspoons per serving. But if you're thinking of taking ACV in larger amounts, it's best to talk to your doctor first, as ACV is highly acidic and can hurt your stomach lining if you have acid reflux. 1. Kale. There are plenty of reasons to turn to dark, leafy greens like kale for your kidney cleanse. This cruciferous vegetable offers many nutrients that can help you get key vitamins and minerals, supporting kidney cleanse. Specifically, it is rich in vitamins A, C, E, and K, fiber, calcium, iron, magnesium, and other kidney-friendly nutrients. The high fiber content in kale promotes digestive health, which is closely connected to kidney function. Note that even toxins from the gut can build up in the kidneys. So promoting digestion may also indirectly help with kidney cleansing. And the great thing about kale is that it has almost no oxalates. Unlike spinach, Swiss chard, rhubarb, turnip, and many other vegetables, they're high in oxalates. When you eat too many oxalates, they get absorbed into the blood and end up in urine, where they can cause kidney stones. So, eating less of those high oxalate foods and more kale may lower your risk of kidney stones, keeping your kidneys clean. Plus, kale has less potassium than many other green veggies. If you're managing chronic kidney disease and must watch your potassium intake, kale could be a good choice. Even if the amount is less than that of other vegetables, the decent potassium content in kale may help prevent the formation of kidney stones. A 2016 Nurses' Health study involving over 3 million people found that eating more potassium reduced the risk of kidney stones by 33 to 56%. Moreover, cruciferous vegetables like kale are known for their anti-inflammatory and antioxidant properties. One compound great at this is glucosinolates. which can help protect your kidneys by reducing inflammation and providing antioxidants. As we mentioned before, antioxidants can help fight free radicals and oxidative stress, taking some workload off your kidneys. Research also suggests that sulforaphane, found in cruciferous veggies like kale, could help reduce cancer risk and even enhance the effectiveness of cancer treatments. In a meta-analysis published in PLOS One, scientists analyzed 12 studies with 1.2 million people and 773 cases of kidney cancer. They found that eating more cruciferous veggies like kale was linked to a 19% lower risk of kidney cancer overall. This reduction was even higher among Americans, with a 23% decrease in risk. While kale is great, variety is even better. Other kidney-friendly veggies are broccoli, Brussels sprouts, and bok choy. They are super versatile. You can steam, roast, or stir-fry them with garlic and sea salt, or add them to your soups, and they're quite kidney healthy. You can also eat them raw in salads or smoothies. And there you have it. The superfoods that can really help cleanse your kidneys. They are tofu, tempeh, seaweed, fatty fish, apple cider vinegar, and kale. Adding these superfoods to our meals sets the stage for strong kidneys and a healthy life, physically and mentally. We hope this list gives you more confidence in your food choices. With these superfoods, you'll have more energy and feel better overall. Keeping your kidneys clean means looking at the big picture. Instead of just worrying about specific nutrients like oxalates, phosphorus, sodium, or potassium, focus on your whole diet and food quality. Opt for whole, natural foods whenever you can, as these are more nutrient-dense with the fewest additives. If we had to share just one tip for kidney cleansing, it would be to cut back on processed foods. They're often full of added sugar, salt, and unhealthy fats. And remember, balance, moderation, and a little culinary adventure are keys. A big picture also includes staying active and following your doctor's advice. Remember, our suggested foods are not a substitute for medical care. Everyone's health journey is unique, so it's wise to talk to your healthcare provider for personalized advice. Also, for the sake of your kidneys, it's essential to listen to your body and manage stress. Chronic stress can really harm not only your kidneys, but also other organs. And don't overlook sufficient sleep to further support detox of the body's systems and hydration. Make sure you're drinking enough water to maintain that light yellow color in your urine. If you enjoyed this video, we believe you'll enjoy the video on the screen. Here, we share the 5 best fruits to help cleanse your kidneys and tips for using them. See you there. And if you're serious about mastering your health and understanding how the body works, make sure you subscribe to us. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Stay informed. Stay healthy. 10 foods that naturally detox and cleanse your kidneys. The kidneys play a vital role in filtering waste and toxins from our bodies. Maintaining healthy kidneys is essential for overall well-being, and one effective way to support their function is through detoxification. While there are many kidney cleanse programs and supplements on the market, nature provides us with a variety of foods that can naturally aid in kidney detoxification. Let's explore 10 such foods that can contribute to healthier kidneys. Ginger, known for its warm, spicy flavor, is a versatile and ancient spice celebrated for its medicinal properties. This root has several benefits for overall health, including support for kidney health and detoxification. Ginger's active compound, gingerol, acts as a potent anti-inflammatory and antioxidant, helping to protect the kidneys from damage and reduce inflammation. It also aids in promoting healthy blood circulation and supporting the body's natural detoxification processes, whether used in teas, soups, or incorporated into various dishes. Ginger offers a flavorful way to nurture your kidneys and boost your well-being with its natural healing properties. 2. Cranberries. Cranberries are a potent natural remedy for supporting kidney health and detoxification. Packed with antioxidants and phytonutrients, these small red berries help prevent urinary tract infections, UTIs, by inhibiting harmful bacteria from adhering to the urinary tract walls. This not only aids in flushing out toxins, but also reduces the risk of kidney infections. Cranberries' detoxifying properties support the kidneys in efficiently filtering waste and maintaining their vital functions. Whether consumed fresh as juice or in supplement form, incorporating cranberries into your diet can be a delicious way to boost kidney health and promote overall well-being. Lemon. Lemons are a citrus powerhouse, with remarkable benefits for kidney health and natural detoxification. High in citric acid, lemons play a crucial role in dissolving kidney stones and preventing their formation. By enhancing urine production, lemons help flush out toxins and impurities, lightening the burden on the kidneys. Additionally, their potent antioxidant content combats oxidation, promoting a healthier kidney environment. Enjoying warm lemon water in the morning can kickstart your day while providing your kidneys with a refreshing cleanse. Embrace lemons in various culinary creations to harness their cleansing effects and support your kidneys' vital functions. For apples. Apples are not only a delicious and popular fruit, but also offer significant benefits for kidney health and detoxification, packed with pectin, a soluble fiber. Apples act as a natural detoxifier, aiding in the removal of heavy metals and toxins from the body. This gentle cleansing effect can help support the kidneys in filtering waste efficiently. Additionally, apples are rich in essential vitamins, minerals, and antioxidants, contributing to overall kidney function. Whether eaten raw or consumed as apple juice, these nutrient-dense fruits make a delightful addition to your diet, promoting kidney health and supporting your body's natural detoxification processes. 5. Berries, including blueberries, strawberries, and raspberries, are a vibrant and nutritious group of fruits known for their exceptional health benefits, especially for kidney health and detoxification. Packed with powerful antioxidants such as anthocyanins and flavonoids, these berries help protect the kidneys from oxidative damage caused by free radicals. Their anti-inflammatory properties also aid in reducing kidney inflammation and maintaining optimal kidney function. Additionally, the phytochemicals in berries support the body's natural detoxification processes, assisting the kidneys in eliminating waste and toxins. Including these colorful delights in your diet can promote kidney health while indulging your taste buds with a burst of natural sweetness. 6. Garlic. Garlic, with its pungent aroma and distinctive flavor, is more than just a culinary delight. It also offers numerous health benefits, including support for kidney health and detoxification. Rich in sulfur compounds like allicin, garlic acts as a potent antioxidant and anti-inflammatory agent, protecting the kidneys from oxidative stress and inflammation. These sulfur compounds aid in the detoxification process, helping to eliminate toxins and waste from the body. By incorporating garlic into your meals, you not only enhance the taste of your dishes, but also provide your kidneys with a natural boost, promoting overall kidney function and contributing to a healthier, toxin-free body. 7. Turmeric, the golden spice renowned for its vibrant color and earthy flavor, is a true powerhouse for kidney health and detoxification. The active compound in turmeric, curcumin, and sage. Boasts potent anti-inflammatory and antioxidant properties that support kidney function by reducing inflammation and protecting against oxidative stress. Turmeric's natural detoxifying abilities aid in flushing out toxins and impurities from the body, easing the burden on the kidneys. Whether used in cooking, as a spice in various dishes, or consumed as a supplement, incorporating turmeric into your daily routine can be a flavorful way to nurture your kidneys and promote overall well-being. 8. Leafy greens. Leafy greens, such as spinach, kale and Swiss chard, are nutritional powerhouses that offer exceptional benefits for kidney health and natural detoxification. These verdant wonders are rich in essential vitamins, minerals, and antioxidants, including chlorophyll, which supports kidney cleansing and detoxification processes. The high nutrient density of leafy greens helps maintain optimal health function, while their low potassium content is beneficial